Hello, everyone. I am Dr. Salvador Medina, a plastic surgeon. I'm talking to you from Tijuana in Mexico from my office. Um, Today, we are going to be talking about mommy makeover.
Hey, doctor, the first question we have is I would like to get a mommy makeover. What does my BMI need to be?
Um, we usually use the BMI as a parameter because these procedures, the body contouring procedures, are not procedures for weight loss. So it is important to be at a fairly normal weight. BMIs, they should be as near as possible as your ideal weight. Sometimes that's not really possible. So a BMI above 32, we usually prefer to wait for the surgery and first lose a little bit more weight. But this is we have to see case by case. There's some patients, I do a lot of massive weight loss surgery. There's some patients that even after surgery, they cannot uh, go under or below a 32 in their BMI, and they're patients that we can do surgery. So it depends. So under 32 would be a candidate, but the closer you are to your ideal weight is better. You're going to have a better result. Uh, the surgery is going to be less aggressive. You're going to recover faster and better. So it is important to be at a good weight before surgeries.
When is it a time to get a mommy makeover versus liposuction?
Liposuction is in patients that have a good skin quality, that they're not really overweighted. Because when we do liposuction, the fat is like a support mechanism for the skin. So if we do liposuction, we take out the support mechanism. So we have to have a good skin quality. So we have a good skin retraction after surgery. So young patients with good skin quality are candidates for only liposuction. Usually in the back, sometimes in the thighs. Those are areas that we can work with only liposuction in many cases. In the abdomen, patients that have had pregnancies, that have lost weight, or just older patients, the skin quality is not that good, so they're not candidates for only liposuction. So after pregnancies, we have to do a skin resection, skin adjustment. So it's a tummy tuck, a lower body lift, a circular abdominoplasty, so whatever you would need. So patients that have had pregnancies or the skin is not that elastic anymore, we need to do skin resections.
What does the mommy makeover include? What parts of the body are included in this, within the plastic surgery?
Mm-hmm. So the mommy makeover includes the abdomen, the back, the flanks, the butt, the breast, and we sometimes can include the arms or the thighs when we do only liposuction. So in the back, we usually do liposuction. For the butt, we do the fat transfer for augmentation and lift. In the abdomen, we do a skin resection for a tummy tuck. We can do liposuction on the thighs and the arms. And the breast, we can do breast lift with implants or only implants. We usually, sometimes in patients that are massive weight loss patients, we do the circular abdominoplasty, which we could also consider a mommy makeover. Just that we do the circular abdominoplasty also for the butt lift, and then we can add the fat. So it covers all these areas. When we do arm lifts, I personally don't do it in this procedure, because then it's too much surgery, it's too long, and the recovery is much more difficult. But if we do only liposuction on the arms, we can add it during the Mommy Makeover. I usually don't include any facial surgery during these procedures. It's better to do that separately. Or if we need to add an arm lift or a thigh lift, we would also have to do that in a separate procedure.
How should a patient prepare before a mommy makeover?
So it's, as in any surgery, it's very important, the pre-op evaluation. We always ask for your medical information. It's important to know what type of surgeries you've had, when you had those surgeries, if you've had pregnancies, if you take medications or not, if you smoke or not. Smoking is very important. Knowing if you smoke or not, because you should not smoke at least 3 weeks before surgery and 3 weeks after surgery. What kind of medications you're taking. If you're taking supplements, there are some supplements that they are organic. They're actually not good to take them before surgery. There are some natural products, not specifically vitamins, but some natural products that they interfere with coagulation, so patients can bleed more. So it's important to let us know what medications and what supplements you're taking. So knowing all this, we would see if we need to first address any other issues. For example, high blood pressure, you have to be well controlled. If you're diabetic, we need to know what your glucose levels are, or any other disease. So it's very important before this surgery, because it is a fairly big surgery. Mommy makeovers can take anywhere from 4.5 to 5.5, 6 hours. So we need to know your medical information, and then we do need some prior lab work, at least 2 weeks before surgery, at least, or between 2 weeks and 4 weeks, because we need to know that your hemoglobin levels are okay. We do liposuction, skin resections, and you lose blood. So we need to know that you're going to go into surgery with an adequate hemoglobin level, because if you're anemic, we can't do the surgery. So you would have to start an iron supplement and then redo that lab work until your hemoglobin level is okay. So lab work before, medical information. I suggest taking an iron supplement at least a month before surgery, because even if you're not anemic, that will help with your hemoglobin level to go into a little bit better level. And stop smoking if you smoke, very important. And it's important that to be and generally healthy, well nourished. There are patients that ask me if it's okay if they need to lose a lot of weight, so they starve themselves, and that's also not a good idea. So if you need or you want to lose more weight, it's better to do it slowly, at a fairly slow pace, so you don't get malnourished, because that's also important for your recovery. So we need to know all this prior to having especially a mommy makeover, which is a pretty big surgery.